You start your day every morning to make sure that your truck is completely stocked. Everything's working like it's supposed to, and you just have to mentally prepare yourself for what might happen. You've got to know the area, you got to know the people, you got to know how long it takes to get somewhere. All those things are going through your mind at any given point of the day. You're providing a service that these people depend on. This has always been a rural area. There's never been a whole lot of industry here. There were stores, the little mom and pop stores. Those are all closed now. I mean, there's just really not much here right now.
I'm G.M. Joyner, Mayor of the City of Glenwood, Georgia. Since 1983, so soon to be 40 years. You know, Lyndon Johnson in '64 come out with the Great Society, where he pumped a lot of money in these rural areas. A lot of farmers were able to borrow money, and people became a little more affluent. It was really a much more thriving community than today. Obviously, as time goes by, it changes to a point. Most devastating thing happened to us was the closure of our local hospital. And it was our mainstay. We were fortunate to have a hospital in our community, and it was a viable hospital.
It's basically boils down to money, same as anything. It's a business. They're there to provide a service, but they still have to make money to pay the doctors, the nurses, all the staff that's there.
I think the little hospital here employed like 100 people, which doesn't sound like a lot, but it is to our community. You have people coming in here, so you like anesthesiologists, and you had radiologists, and on and on and on. You know, for a little community, you just had people in and out, and you know, they're gonna buy a little something, you know. I can't emphasize enough, since we lost the hospital, we've lost our local bank, lost our grocery store. In fact, there's not a grocery store in this entire county. And for a while, we actually lost our pharmacy.
As far as the town goes, I mean, look around you. I mean, see the boarded up windows, the stores are closed. I mean, people came here for their health care. They came here for x-rays, lab work, and seeing their doctors, but they don't come here anymore. People don't think about something unless they need it. And as far as health care goes, a lot of people take it for granted. It's not going to happen to me. I'm not going to need this. Why should I pay extra for this? Our costs go up every day, and the reimbursements that we receive from Medicare, Medicaid, and insurance do not come up.
You're going to have to increase the reimbursement rates. In the last few years, they've done the complete opposite. They lower the reimbursement rates. And I understand that. From a business point of view, I understand that. I'm a capitalist by nature. And obviously, it reeks of socialism. But even the hospitals in larger towns like Dublin or Vidalia, Savannah, if it wasn't for the Medicaid and Medicare, they couldn't keep the doors open either.
There's always going to be profit made somewhere. It's just not going to be made right here. You catch a lot of grief. That grief comes from the family, from the patients, and they're scared. They don't know what's going on. Does it frustrate me? I don't think about the money when I pick up a patient. I don't ask about insurance. That's just not the way you do business. You just take care of the patient, get them to the door. Somebody needs help with a problem, and you got to come up with an answer and help them. And that's my job.